Nearly 130 years ago, the doors of what is currently St. Lucia's Principal Hospital opened at Castries. We were then under colonial flag. We were then under British rule. And that facility was named after the monarch, sovereign of the time, Queen Victoria. Today, we are a free people in an independent country and enjoy our own sovereignty. And with each and every step, we must purposefully resolve to define a future of hope for our people. In this journey, we must be mindful of who we are, a people with a unique identity who understand the values of honor, gratitude, and integrity. And so instead of naming a facility after a sovereign, we have chosen at first glance an unusual combination of names: the Owen King EU National Hospital. In doing so, we give honor to a surgeon, a son of the soil, a pioneer, a superb practitioner who practiced his craft for the love of it, for the benefit of all, the poor and the rich, the distressed and the able. His example is unparalleled. It is available to be emulated to provide inspiration to all healthcare practitioners and professionals. The mere mention of his name, Owen King, should be a reminder of the importance of sacrifice in the altruistic pursuit of helping each other. By inclusion of the name EU side by side with the name of our distinguished son, we have also chosen to give honor, thanks, and appreciation to a group of nations, the European Union, for what is a magnificent and monumental gift. We need to pause just a few moments to understand this gift from Europe. There is none like it in our region, and I'm told from time to time, there never will be one like it ever again. It is an unusual combination of names, but somehow it captures the imperatives of the message we wish to convey. We are naming a facility that will be spoken of one way or the other by all St. Lucians for generations to come. We are naming a facility that will operate as a critical part of people's lives, where our children will be born, where we come to find healing, comfort, and solace. And so this name, the Owen King EU Hospital, must be uttered with respect, reverence, and appreciation. It must be spoken by St. Lucians with a positive conviction, with confidence as a place of high standards, quality, professionalism, a place of excellence. We signal by naming this hospital a break with the past. We set a new path with this new health institution. The right to life has long been accepted as a basis for society and a fundamental element for human existence. The world we would all want to live in is one in which every human being, every citizen, every resident might have the right to quality health care. And promoting and advancing such an agenda for long, healthy lives suggests and requires access to the very elements that sustain life: healthy food, clean air, clean water, secure shelter, accessible health care, and knowledge. We embarked over a decade ago to change the failing state of healthcare in St. Lucia. It has been a long, impatient journey. And while we are not there yet, while this journey continues, we are on the right path. We accepted that the 19th century Victoria could not be our 21st century solution to our health infrastructure requirements. We were also weary of another antiquated, outmoded institution at Golden Hope, and we knew the time had come to set a new course. And so started this vision of a new medical complex here along the Millennium Highway with its uplifting and panoramic views. It has been a long journey from the very moment when the idea was conceived. There are many to remember, and the opportunity will come soon to remember them. However, there is one whose unique contribution must not be lost among the cacophony of voices. I refer to one of our former Ministers of Health, Damien Greaves, who fought for the establishment of the Wellness Center next to this national hospital to form one complex so that both institutions could enjoy synergies through common services. This government is committed to see this dream become a reality for all St. Lucians. Because we know our pregnant mothers and newborn babies deserve it, because we know our children deserve it, our medical and health practitioners need it, and our aging society demands it. And while we can try our best to live healthy lives, to eat right, to exercise, to practice moderation, to stay away from habits that are injurious and destructive, as my Minister for Health preaches continuously, not one of us here knows when we might have to end up behind these doors, seeking a diagnosis, seeking treatment, seeking healing. And any one of us can fall sick or become hurt or injured in an instant. We are, in different ways, so vulnerable. Time and time again, we have to yield to the frailty of our human existence. And this is why we must find a formula, a sustainable solution to ensure that every St. Lucian, no matter their income or station in life, has access to health care. Our citizens deserve the calm assurance that in times of ill health, access to quality health care is available and within their means. That is why we must make the collective sacrifice to finance a system of universal health care, even if it means at the outset unwelcome choices. Universal health care must be a national priority, accepted by all parties, supported by all St. Lucians. It cannot be seen as only Kenny care or Alvina care. It must be, as it says, universal health care. It is everyone's business. Our nation must be at peace with itself. For many years, the cry of our citizens has been simple. Why should we have to travel to Martinique or Cuba or Trinidad or Barbados or the United States for treatment? As so many have discovered, seeking health care abroad is expensive business. The cost of some surgical procedures in the United States, for example, can wipe out some of our budgetary allocations for health services in our annual budget. To be sure, we must be grateful to all those countries that looked after our citizens when we could not do so. But that does not erase the indignity of dependence on their generosity. We need to remember that healthcare, the state-of-the-art equipment, the specialists with their training and experience, the treatments, the medications, these come at a high cost. And these costs seem quite unattainable unless we pool resources together as a people to address them. For instance, the radiological equipment in this hospital cost millions of euros. And it will cost millions of euros more to maintain. Attracting specialist technicians and professionals to a small country is not easy. That is why we will always be grateful to the Cuban government for their assistance with providing healthcare professionals. And this is also why we are deeply grateful to the European Union for what I described as this monumental gift. We as a nation place on record our thanks, gratitude, and appreciation to the people of the European Union across all its member countries for this tangible and transformational gift. And this gift covers the physical plant of nearly 150,000 square feet, modern sophisticated equipment, including state-of-the-art MRIs and CT scans. Indeed, I've been reminded in private that what the European Union has given us here is far more sophisticated than what exists in some of their own member states. It also includes assistance with the training of health professionals, all to the value of an estimated 200 million Eastern Caribbean dollars. We know this gift means a lot to the European Union as it means to us in St. Lucia. This is the largest investment the EU has ever made in the Eastern Caribbean. Without a doubt, we will be opening in due course what will be one of the most modern hospitals throughout the English-speaking Caribbean. Ambassador Barford, convey this message from us to Europe. Thank you. Thank you from each and every heart. Thank you. We assure you that we would jealously look after this gift so that Europe could feel justified that it was worth the investment and the effort. We must too make special mention of one European country that has been generous to us over the years in the area of health. At Victoria Hospital, and now with the Dr. Owen King EU National Hospital. And this partner is, of course, France, but also the local authorities in Martinique who, despite all, have insisted and persevered in extending support to our country and our people. So many St. Lucians have found respite and care at institutions such as La Menade. And at times, they have left behind more than their ailments, but also unpaid debts. We know we must resolve this, if only in honor of the friendship that we share. We continue working closely with the French and Martinican authorities and their professionals in pushing towards commissioning and operationalizing this beautiful facility. We would not be able to do this without their help, experience, and commitment. We hope as well that other partnerships will be realized to make this complex become a center for teaching, for research, and medical excellence. My friends, building and commissioning a hospital is undoubtedly a mammoth, complex undertaking. But running a hospital is just as, if not more, demanding. Our health system is dependent on the hard-working nurses, doctors, technicians, public health administrators, support staff, health planners, cooks, cleaners, and so many others. They keep the arteries, veins, and capillaries of care pumping continuously without respite. This naming ceremony is as much about them as anyone else. As a country, you know our means are limited. As Minister for Finance, I am mindful of this all the time. The many competing interests, all of which are important to national development, education, health, security, infrastructure, you name it. For these reasons, I often speak of competing priorities. And yet, we must continue to strive against these odds to realize what our people deserve. Today we must resolve to do our best individually and collectively. Today we must resolve to push hard to make the transition to the new hospital a reality. We are so close. We are nearly there. We must take the final steps. To ensure that we do so in a strategic and focused way, the Cabinet has decided to establish the post of Director of Health Sector Transition to oversee the opening and operationalizing of this hospital, as well as St. Jude Hospital in the south. This director will also be charged with the responsibility to institute a system of health financing to pave the way for the implementation of universal health care. We say thank you to those nurses, those doctors, to those who think more about the patients under their care than the inadequacy of their paychecks. We say thank you to Dr. Owen King, whose memory we institutionalize and cast to stone today. Alison, Jane, Derek, Stephen, Mandy, I know you and the entire family would have wished your father to have been here to see this national achievement of a new hospital. Even though his shyness will induce him to cower at the sight of all this recognition. I know too, you would have wished your mom, Anne, and also Suzanne to have been here to witness this day. Yours is another of our extraordinary St. Lucian families, family of passion, excellence, compassion, undying love and commitment to our people and our country. We say thank you. Thank you very much. Hold on proudly to the memory of your parents and carry on their legacy of love and service. And to all those who continue to work towards realizing this national dream, we salute you. Opening this Dr. Owen King EU Hospital is our next step. This is a commitment, an undertaking to be embraced by all, not only the Ministry of Health or the Office of the NAO. It is a national effort, and all of government must support. We can make it happen. Let's make it happen. Let us make our European partners see our gratitude by embracing this wholeheartedly. Let us make the memories of those who have gone to the silent continents, to the unknown realms, real and tangible by honoring their legacies, what they stood for, and what they proclaimed. Ladies and gentlemen, let us make ourselves proud on our 37th birthday, the 37th anniversary of our independence. Ladies and gentlemen, I thank you and wish you a wonderful afternoon.